like I said, tell me about the hotel. Is there hotels, or do we sleep in teepees, or do we give them a little
not anymore
tent? One thing we will tell you is if you're looking to get a large treatment done, you cannot cross more than $10,000. What about financing?
We do offer financing. It's through United Credit. It used to be UMC. Now it's just UC.
And with them.
Yeah.
So how many shuttles do we count with?
We have 2 shuttles, but we have 3 destinations.
You know, we used to have this problem a lot when our patients cross the border, and then there is something called pickers.
Oh.
So the pickers will tell you whatever you want to hear to be able to take you with them. But it's very important that if you guys have, no matter if it's with Supreme or anywhere you guys want to go, it's okay to have a second opinion. But go on with whatever you guys researched. Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. Don't forget to like and subscribe. We also have a phone number. We have an email address. You can drop us an email, leave us a voicemail. Remember, everything you want us to speak about in this podcast, we got no problem. This podcast is for you, our patients. And today we have one of our patients coordinator with us. We have Mr. Manny, Mr. Money Manny.
Hi guys, everybody. It's a pleasure to be here, and thank you for having me on today.
And Manny, a couple of things that we want to talk about today is the different services that Supreme Dental gives to our patients. We've had a lot of questions of, well, I'm going to fly to this airport. Can they help me out? I'm flying into Yuma. What's going to happen? Are there hotels here in Los Algodones? Is it safe? Is there things to eat? Everything that we do to concierge to be able to help our patients out. So if you can let us know a little bit about that, walk us through if I'm a patient and I'm flying in from New York. Take it on.
All right. So basically the way it starts is that we have several agents also from the agencies that we work with. They contact us directly when they have a lead. Let's say we have ex-patient. You know what? We have John. He's flying in from New York, and he wants to know what's the nearest airport to you guys and if you guys can pick him up. So right off the bat, they send us a message, and once we have time, we'll answer it right away and let them know, you know what? We have the Yuma airport. That's the closest to us. And they're like, all right, so the patient will fly in on Monday. He'll get there around 11 a.m. So once they send us all that information, we're going to go ahead and set it up with our Yuma shuttle, all right? And we'll call the patient to let them know, you know what? John, we already received a message from so-and-so letting us know that you want to come down and get attended here at Supreme. We're going to go ahead and set up your shuttle. So when you fly in, you're already going to be looking for our shuttle. It's going to have our logo on the back window. You just can let us know what you're wearing so the shuttle driver can identify you or send us a picture. That's a lot easier.
The picture is very important.
Yeah.
We actually like to send our patients also pictures of our drivers because we have 2 different drivers.
Yeah.
And I know it sounds kind of weird, guys, but sometimes there's been issues that we've heard from other places that somebody else tries to pick patients up stating that they're a certain clinic and they take you to another place because obviously you guys don't know your way around. So it's very important that you guys get that picture, know what our driver is going to be wearing. And then our driver also has a customized whiteboard, which I made it fairly big.
Yeah. A little heavy too.
A little heavy. They're getting buffer, so that's a win-win. But they have that with your guys' name on it, so you guys know that wherever you're gonna pick up your luggage or at a certain gate, they're gonna meet you there, and they'll be able to help you with your luggage and bring you to your destination.
Yes, that is correct.
So how many shuttles do we count with?
We have 2 shuttles, but we have 3 destinations.
Okay.
We have our local Yuma shuttle that's run by Francisco. And he's your father, I believe.
Yeah,
also.
He is my father.
So he's the one that runs our Yuma shuttle locally, and I'm the one that has direct contact with him. So all the shuttles that need to be set up in Yuma are handled by me. And then we have our San Diego and our Phoenix Airport shuttles. Those are handled by Gabby. And we have the shuttle driver, whose also his name is Francisco.
Francisco. So it's kind of like a combo. And what do they do exactly?
All right. So whenever they have a shuttle, they make sure that they're there on time. Sometimes they're trying to be there as soon as possible. If their flight lands in Yuma at 11:09, your dad's gonna be there at 11 a.m. Trying to see, and then he was gonna give me a call. Hey, did the patient let you guys know if he arrived? Is his flight delayed? So where you have constant communication with the shuttle to try and give you guys that better service. So we know that you guys aren't standing out there in the heat, or if you guys are going to be delayed, he can go drive around a little bit. So that's what mainly we try to go ahead and get focused on.
And it's very important that if the patients need the shuttle, they let us, if possible, they let us know 48 hours prior.
Yes.
A lot of the times our patients tell us the same morning, hey, can I get picked up? It's 7:55 and their appointment is like at 8:15. And that's when it makes it a little bit difficult because they might have 3, 4, 5, 6 other pickups. So then we'll go pick you up eventually if it's from Yuma because we're so close. But if you're from Phoenix or San Diego, you're looking at almost a 3-hour drive or a little bit over a 3-hour drive, also depending on the traffic. So it's not like, well, you know what, I'm gonna arrive there at 11 and it's 10 o'clock. It's gonna take us some time. Sometimes there's a border crossing. Sometimes there's no line. Sometimes there is. So that's why we do it in advance to be able to accommodate you guys as much as possible.
Yes, that is correct.
Now, what is the patient to expect when they cross the border?
When you guys come across the border, it's actually pretty simple. There's just one walkway where you guys are going to go through customs on the Mexican side. Sometimes they don't even ask you guys for any identification or to declare anything, unless they find you guys a little bit suspicious. But that's mainly on them.
Mexico's pretty laid back.
Yeah. So it's pretty easy when you guys get dropped off. If you guys are driving in or, going to the parking lot, it's like a 2 or 3 minute walk. If it's your first time here, we're going to go ahead and have someone meet you at the border. We're going to send one of our staff members. It could be Francisco. It could be Miguel. It could be Martin. Anyone. They're going to have that big whiteboard that's customized. They're going to have your name on it, and they're going to wait for you. So when you guys are coming across, just search for that whiteboard. It's going to have your name, and they're going to guide you. The clinic is literally like half a block away from the border, so it's pretty smooth walk. All right.
What are you we used to have this problem a lot when our patients cross the border, and then there is something called pickers.
Oh.
So the pickers will tell you whatever you want to hear to be able to take you with them. And a lot of the times people travel to us because they're looking for something to be less expensive. And these people will tell you whatever you want to hear to make sure they take you with them. And in some cases it's pretty dangerous because you don't know where they're going to take you. You don't know if the clinic has the accreditations. You don't even know if the doctors are helping you are actually real doctors. We really can't help you there. We've had many stories of patients that follow the pickers and then they come back. Like, I don't know what happened. I had one, actually, I don't know if you were with us at the moment yet, but the patient followed a picker, had multiple implants done. It was in 2020 when the border was closing at 2:00. Right now the border is closing at 10. So it was closing at 2:00, the border. And they literally rushed him out of the chair like, oh, you need to go if you want to cross the border. The patient didn't know where he was at. He was across the United States. He didn't know what happened. And because of the time and the office did not offer like accommodations for him, they left his bone not straight. They left it all bumpy. They didn't put sutures in different places. So he had to go to the hospital, and he was there for 3-4 days. And that could happen anywhere. We had numerous horror stories from different places in the United States also. When either the doctor doesn't let you guys know exactly what's going on or the patient doesn't fully understand, and it becomes not the best story that you want to tell. Here we focus on what we do and we run our own race, very importantly, but it's very important that if you guys have, no matter if it's with Supreme or anywhere you guys want to go, it's okay to have a second opinion, but go on with whatever you guys researched. Don't let just someone come and if it seems too good to be true, and I've said it before, it probably is, so make sure you guys go with the choice that you guys picked back at home, so these things don't happen, you know?
Yeah, I always tell them, you know what, if you guys are going to go get second opinion, you guys are welcome to. Make sure, you know, your new dental office where you're going to get your second opinion, they at least are ADA certified, you know. There's very few clinics here in Algodones that are ADA certified. I also tell them, make sure that, you know, they give you good quality work, you know, because if they're giving you cheaper, they have to be compensating it some other way. And we don't know if it's in the material or in the labor. So that's one thing you got to look out for.
That's actually a pretty scary thing.
Yeah.
Now, another thing that you talked about ADA, and I haven't mentioned in any of our other podcasts, but if a place says they're ADA international members, make sure that on their website or whatever agency you're coming through, they have the ADA license there, because they have nothing to hide. That it's not like their social security, so it's not like you can steal their identity. But then you know that you can verify them through the ADA webpage. Anybody can say they're ADA international members. Everybody here has it, and a lot of places has it stamped on their window. That doesn't mean that they're part of the ADA or that they're currently part of the ADA. A lot of clinics, they have one person that's ADA, and now they say they're ADA, but this is a certification that goes to each and every one of the dentists.
That is correct.
It's not just like a one shoe fit all. We're going to throw it at a clinic and everybody's ADA certified. And that's one of the problems that I see with different agencies, is that people talk about ADA, but then they don't show the accreditation. They don't show the license number, and there's nothing to hide. Like, patients need to see. You need to be as transparent as possible, because you're a medical facility.
Exactly.
So we need to make sure we have that. But another thing that we get asked a lot is, do you need a passport? I know that you have something. If you guys want to go check it out, it's 7 things you need to know when you cross the border, or 7 things most.
7 things you need to know before coming down to get dental work done at Supreme.
There you go. So one of the points is, do I need a passport?
If you have one, that would be great. You know, obviously it's going to be easier to get back and forth to Mexico and back to the United States. If you don't have one, you don't really need it. Any government issued ID or form of identification is going to be well. Driver's license, regular ID, birth certificate, or just your social security number, that's going to get you guys back to the United States. Coming into Mexico, they don't really ask you for anything, so you don't really need it to come in. You basically need it to get out.
One thing we will tell you is, if you're looking to get a large treatment done, you cannot cross more than $10,000.
Yes, that is correct.
You cannot cross more than $10,000. So if you let's say you husband and wife are coming, you guys can split it 5 and 5 if you want, or whatever it is. But you cannot have in your pockets or in your luggage more than $10,000, because then you'd have to pay taxes. So that's very, very important. You can pay some cash. You can bring back the next day some more cash or whatever it is, but you cannot bring it all at once.
Yeah, the way I tell them is basically 10,000 is the limit. So it doesn't matter if it's one person. If he has those 10, they can't do anything about it. If you have over 10,000, the way they told me is that they can tax you between 20 or 50% on the additional money that you bring over the $10,000. So that's a lot.
Wow.
So the way I tell them is, if your treatment plan is going to be $15,000 and you're going to be coming with someone else, you can split it half and half. That way there's no issue. Another thing is, if they don't have someone that they're going to be coming with.
Yeah.
Sometimes we're able to have one of the shuttle drivers, meet them across the border before they come. They can hand the shuttle driver, half of the money. They'll drive them across, no problem. Once they get to the clinic, the driver will give them back the money so they can, come into the clinic. That's if they want to take advantage of that 5% discount we offer with cash payments.
That's true. We do have a 5% discount. Tell me about how safe Algodones is, because a lot of patients they watch the series of Narcos, or they watch the cartel gangs, and they think Algodones is this big cartel. I had a patient once that told me if we can go pick them up at the border, and I said, yeah, no problem. They're like, you're not able to walk? Do you want a wheelchair? And they're like, no, can you come pick us up in a vehicle? And I'm like, we're like half a block away, and what's going on? And he told me, well, I've heard that there's dead people laying in the floor in Mexico. And I told him, no, that's The Walking Dead. That's not here. And the patient later on apologized, because he she felt actually pretty embarrassed. But that's the figure that they put on different and TV about Mexico.
The news,
that's scary or whatever it is. Obviously, they want all the money to stay where it is, right? So, tell me about the safety. I mean, you actually live here, right?
Yeah, I actually just moved into Los Algodones about a few months ago. It was easier than having to drive back and forth from San Luis, so it's actually pretty safe. You don't have any troubles. The cops don't even harass you like they do in most of the places. And there is no cartel activity that you can be seeing right here. It's pretty touristy. So you actually have more Americans in your day-to-day, contact than with locals, actually. So it's pretty safe.
If you're going to get attacked here, it's going to be by vendors.
Yeah.
They're going to try to sell you.
Or the pickers.
Or the pickers. They're going to try. Pickers are going to try to take you somewhere else. Vendors are going to try to take you to. They're going to try to sell you a gold chain, silver chain. Whatever.
A Mexican Rolex.
A Mexican Rolex. Novelties you could take back home. So tell me about how you feel. Tell me about like I said. Tell me about the hotel. Is there hotels, or do we sleep in teepees, or do we give them a little
not anymore
tent? You scratch that one out.
Yeah.
But, so we don't give them tents. We don't give them anywhere. Rollover beds. Where do patients stay?
All right. So currently in town, I believe there's about 5 hotels. You have California Comfort and Suites, which is the most common one that patients ask. It's about maybe 3 blocks away from the border, but the one that's easiest for our patients and more comfortable, it's more accessible. It's literally right across the street from our first clinic in Plaza Guadalajara. It's called the Baja Resort. So the way we get the reservations for our patients is when they're making their appointment. If they have a shuttle arrangement, sometimes they ask us, is there a place we can stay? So we tell them we have the Baja Resort, which is the one we work with. It's a family-owned hotel, so only people who can stay there are one of the 4 family clinics. So Supreme is one of those 4 clinics, and if you guys are staying, getting attended here at Supreme, you guys are welcome to stay at the Baja Hotel. Just let us know when you guys are making your appointment, and we can help you guys make that reservation. It's pretty simple, pretty accessible. They cost, I believe, $70 a night. And sometimes we have different promos that include hotel accommodations for you guys that makes it a little bit more accessible.
And not just that, Baja Resorts is like in the it's like in the Times Square of New York, but of Los Algodones, because everything happens within this block radius, and it's the only hotel that's located in that block radius. So literally you could walk out of your hotel and you could, within 50, 70 feet, you got another place that you could buy, you can get medication, or you can get sandwiches, you can get ice cream, you can get...
you have like 4 pharmacies.
Salad.
You
get attacked by pharmacies. There's a lot of, thanks George, there's a lot of booze you can buy around here also. George probably knows about that. And there's different things that you could find. Everything is here, and being able to go to the clinic and just cross back. I mean, you're just crossing the street. Our cosmetic center, which is another one of our facilities, is literally, you walk out
like 3 feet from there,
and there's the first door of suite. That's so that's what about places to eat?
There are several places to eat right now in the summertime. Some of them close down, for maybe about a month or 2. But during the winter, you have Rancherito, you have pita, shrimp, and fish tacos. Those are the ones we recommend the most. You also have the restaurant that's right outside in Plaza Guadalajara. I believe it's called La Tetilla. You have a restaurant called Mi Casa es Su Casa. You have Pueblo Viejo. I believe there's one called El Paraíso. And also there's another restaurant in Hotel California on the bottom floor. It's called Margarita. So you guys looking for drinks, food, you guys have it anywhere you guys look.
At Baja Resorts, they also offer free breakfast. So it does come with a coupon where you could have breakfast right across the hall from our Supreme Dental facility, and you'll be able to. I believe it's for two people. And also at Baja Resort, I'm going to speak for Baja Resorts because I haven't been to any other hotel here. But Baja Resorts have a fridge. They have a mini fridge. Yes. So you could go and you can bring your favorite snacks. If you want some special chicken noodle soup you want to have or whatever it is, you can have everything there, and you're set to go.
They're actually pretty equipped. The rooms there, you know, you have your king size bed, you have your TV with your Wi-Fi, Netflix, you have a microwave, the mini fridge you mentioned. They even have a hair dryer, ironing board. They have a coffee maker. So if you guys don't want to leave your room, you guys are pretty much set.
And more than anything, you don't have people that are trying to party or do anything else there. It's just patience, strictly patience. If you walk up and you say, hey, I want to stay here, and you're not staying with one of the 4 clinics in the family, you cannot stay there. Like, the reservations have to come through those clinics. You cannot go there and do a reservation yourself.
Yes, that is correct.
So, you know, we talked about the security. We talked about the shuttle service. We've talked about the way that some agencies work and they contact us. We talked about places to eat. We talked about being attacked by pickers. What else do you consider important for our patients to know back at home about the services that we provide?
All right. So basically, if the patient has any questions, they can give us a call directly. Sometimes the promotions are, you know, set with a certain price, but we can, you know, break the rules a little bit, customize it to the patient's needs, and that's one way we can help you guys out a little bit more.
What about financing?
We do offer financing. It's through United Credit. It used to be UMC. Now it's just UC.
And took away the M.
Yeah. So basically, you can apply. Give us a call. We'll send you a link through text or through email. And the way you do is they're going to ask you pretty much basic information regarding your credit score or something around that. They might ask for a deposit. It's normal now since they did adjust some things on it.
So I know that through United Medical Credit, you know, we're able to send the links, and we're able, or United Credit, where you took away the M already.
They took it away.
They took away the M, and you're able to finance. So you could be here at the clinic. It's always best. You can apply at home and see how much you're approved for, but we don't approve it until we see you, because it could be less, or it could be more, or it could be something different, and we don't want to close it on you, so you have to rerun your credit, and we don't want that to happen.
Yes. For example, right now we actually had one, and they had to ask for a little bit more money, but once you already leave a down payment, they're going to tell you you have to cancel that order, reapply again, and then see if they loan you the new amount. So it's better if you just do the application right here in the clinic. It's pretty quick. It takes between 45 minutes to an hour and a half, and they'll let you know if you're pre-approved or not.
Yeah, and you don't have to send any fax or anything like that. We go ahead and help you take care of that as much as possible. Obviously, like I said, everything is custom. You will have different options depending on what you're going to get done, and then you go ahead and pick the option. A lot of times you think you came to buy the Toyota, which is amazing, but you really like the Mercedes. So, you know, the Mercedes does have a different cost, and because of that comes, you know, obviously different down payment and things like that. But everything is whatever. I mean, you're going to choose exactly what you want to go for, unless it's something that's needed, and then we let you know exactly. Well, thank you so much for being here today. I know you're extremely busy. I know with people being in vacation and what's not, you know, you run a tight shift here. So we want to tell you that, you know, we appreciate all you do. I feel a lot of the times our receptionists don't get the love that they deserve, because you guys do take on, you know, phone calls, you guys take on emails, you guys take on somebody being stressed because something changed, or people that come that they have some sort of pain and they're just upset with the world, and you guys take all that heat. So I feel that sometimes our doctors get all the love because they see, oh, he changed my smile. But in behind the scenes, the ones that were checking on the labs, the ones that were checking on your shuttle, the ones that made sure that you guys got here in time, you guys have your hotel, you guys know where to eat, you guys have all that information, is you guys. So thank you so much for that. And with that, we wrap this one up. Thank you so much for following us here at Supreme Dental Podcast Studio. Like I said, don't forget to hit like and subscribe. Also, don't forget to send us a text message, send us an email, anything you would like us to talk about in the future. That's what we're here. We're not actors. Manny might look like an actor. He just got a haircut. But we're not actors yet. So thank you so much for following, and we'll talk to you guys soon.